Well, look, the quantitative immunity testing is a screening method that enables you to evaluate an individual's level of sterilizing immunity to the virus that causes COVID-19. And so, in other words, what it gives you, it allows you to identify those individuals who are a very low risk of transmission because they have such level of immunity that they could not be carrying the virus. Their body would just eliminate the infection straight away. And so what it enables you to do is really allow these travelers who have this level of immunity back into the community much sooner without quarantine, and really focus the energy and the resources of the government on those travelers, for instance, that are a material risk to the community.
So just a finger prick.
Indeed, it's just a finger prick that you just use a tiny drop of blood. It's very painless, and essentially you put it on a disposable cartridge, a disc. It's a miniaturized lab on a disc, and the disc goes into a machine, and within 15 minutes you get the results. And so that's the whole point, and that's really quite innovative about this test, is that it can be deployed at the point of need. It's highly scalable in high volume environments such as airport and quarantine facilities. So that's a key enabler for using it as a border screening capability.
How accurate is it, Xavier?
Look, it's extremely accurate. I have to say that's what really different for this test is that the traditional infection testing methods such as RT-PCR or antigen test, they look for the virus, which is actually virtually undetectable. It's notoriously inaccurate during the incubation period, which is the first 5 to 10 days after exposure. And that's the main rationale for quarantine. What we're looking for with quantitative immunity tests is not whether you have the virus or not, but whether you would be capable of carrying it even without symptoms. And that's really what's really quite critical, because it means those travelers who are determined to have this high level of sterilizing immunity are not a material risk to the community, and they can be released without quarantine.
So is it your idea is to have it in quarantine first and then at airports and terminals, travel terminals?
That's correct. We want to start with quarantine initially, and because it's really where the bottleneck really is at the moment, and progressively move it back into the airport, probably more on arrivals initially, but eventually we intend to have it on departures as well, mostly because you would want to test yourself before you get on the plane, so you know whether you'll have to go through quarantine or not on arrivals.
How are your conversations going with government officials at the moment?
Look, we've briefed all levels of government, the chief medical officers and health officers of both federal and state and territories. So it's progressing well. We're at the beginning of the engagement. In New Zealand, we're in the final stages of the validation studies that we're expecting to start imminently, and that will support the regulatory approvals. And in Australia, in parallel, we're hoping to collaborate with the border agencies and the health agencies around how to integrate that solution into the wider border ecosystem, including, border risk assessment, the passenger journey itself, and we also are exploring the implementation and integration into our digital identity wallet solution. So it's a self-sovereign solution. Essentially, you'll be carrying your passport data as well as your test results into a mobile application, and you and only you have control over who you decide to share it with, and that's a very important aspect as well of the solution.